Okay, it's great to see everyone. You can move down, there's plenty of seats up front. None of us bite, it's okay. And welcome to the Spotlight series on Uganda. We're very excited about this. I personally am really excited and honored and pleased that they asked me to be part of this. So I'm really thrilled that we could do this. You know, part of the whole idea of these Spotlight series is to bring special attention to areas, countries, issues of concern that we just don't think are getting the kind of attention that they need. And this is an opportunity for us to shine a spotlight on them and hopefully garner some greater attention for them. So I appreciate the time you guys are taking to come in and sit on this session. I'm not going to go into too much because Jane's going to come up and introduce the session, so I will turn it over to Jane Nabunya. I think all of you know her by now. She's been an ever-present face in a lot of our plenaries and other events. She's the IRC Country Director for Uganda, and of course, a fantastic representative to speak to you.
Thank you, Aaron. Thank you very much. Good afternoon, colleagues. Thank you for coming. Spotlight on Uganda. Why are we spotlighting Uganda? Because we would like to share a few things, especially related to what is happening as we try to deliver area-wide inclusive sanitation, leaving no one behind, but also putting emphasis on sanitation, looking at the policies, looking at the policy achievements. What have we achieved? It's not been rosy, but it's also been very gratifying. Even with the baby steps or the toddler steps, I think we've done great, but we still have limitations, and we see a bright future. So in this spotlight, we'll really focus on that, delivering area-wide inclusive sanitation, how we are trying to improve inclusive sanitation services in the urban and in the rural. Sometimes the divide is very thin, but the demarcations are also clear. And we'll go through the different policy arrangements that are in place, specifically the citywide inclusive sanitation, looking at the big cities, looking at the small towns, town sanitation planning, but also not forgetting our old cousin, community-led total sanitation, because that one is also still there. So thank you for coming. Thank you for joining us. We'll first go through some bit of meat, get some bit of context, and this will be given to us by our Assistant Commissioner, Engineer Dr. Felix Twinomchunguzi, who will take us through that. After that, we'll have a quick, and he's going to present some. He's going to present some slides, a few slides. We'll share that information on slides. After Dr. Felix, I will invite Aaron to come and take us through a brief panel, just to deep dive on a few things, taking on what Engineer Felix will have provided, and thereafter we will close. We'll have a discussion. Any questions from the participants will be welcome after Engineer's presentation and the panel, and then we'll wrap it up. Dr. Felix, please come and share with us what you have. Thank you.
Thank you very much, Jen. Thank you very much, Aaron. So, area-wide sanitation. We give just a brief background where this is coming from and what are the basics and why are we looking at the entire areas of consideration. We start off by very brief. You can see most of us, those who may not know where Uganda is, just setting the context. That's a brief demographics about Uganda, a small, tiny East African country, population now grown about 46 million, about more than close to 80% of these living in rural, 30% in urban, and it's a middle income, really striving to reach middle income status. But we still have these unfortunate deaths recorded, and this is a measure that we use, that we normally look at to signify most of these are dying from diarrheal diseases, and sort of it's an indication of sanitation challenges in the area. And this is, of course, again, as exemplified by the statistics that we have, that in the urban areas where we stand, almost about 40% of Ugandans have access to what we call safely managed sanitation. This is in urban areas, which is slightly better in the rural areas. It's even worse. It's something about 10% by our measure. And the unfortunate bit is when you look, this is largely the same situation across most of the developing world. You can see the case in Zambia, in Tanzania, our neighbors. It is quite a similar intervention. And when you look at, the global averages, the developing world is still struggling so much with this challenge, which is so problematic. And we have a tool here that we developed using what we call the sheet flow diagram, I think developed by colleagues from here and the UNC, and just to highlight how this sanitation ends up into the world. And you see that almost 60% of fecal matter ends up into the environment. That red depicts unsafely managed sanitation, while the green depicts what is considered safely, which will not lead to disease. So more than 60% of this fecal matter in areas still ending up in the environment, and this is what is leading to this kind of deaths and all other sorts of challenges that you can imagine, environmental problems that may come with it. 2015, sort of the Sustainable Development Agenda. I think a good number of you and politicians came here to New York and agreed and left this very ambitious target for us to work on. Try to ensure that you have adequate sanitation for all and open defecation, special needs to women and girls, and especially people in vulnerable situations. This is, the motto that the series that we are all working on, and as governments we are trying to see what can be done. We are trying to figure out the different approaches, what could be done, what should be done, to make sure that you try to provide adequate and equitable sanitation for all. Of course, the open defecation is very clear, demarcation, but also getting about vulnerable situations. You know that in urban areas, we have vulnerable situations like informal settlements. All these areas, the poorer people who are most difficult to serve. Those are the most difficult members of society how to serve. And the thinking around this was, we cannot continue on business as usual, trying to continue struggle to implement sewerage interventions, try to continue different approaches. So part of the discussions, these are not only in Uganda, but also other which have been tried, but Uganda has been a leading case study with, for example, one approach that we have tried in the capital city, which is called Kampala, is a famous citywide inclusive sanitation. This was something promoted by the World Bank, and other areas, other partners have also jumped it, but Kampala was one of the areas piloting this approach. And what is it? In essence, the citywide, that will look at the city in its comprehensive terms. When you go back to the policy documentation, you look at what we came up with in the Constitution of Uganda and the environmental health policy. Whenever we talk about cities, what is said there is that everybody should be connected to a sewerage network. However, 30 years, we are celebrating, this month we celebrated 62 years of independence as a nation, but still 62 years of independence, we have only about 15% of the population in Kampala connected to the sewerage network. So if you have to move from 15 to 100% reach, so in 65 years, we have achieved 15%. So we need, I don't know how many, 200 years if we were to achieve. This is completely unachievable. So we had to make a policy shift in the direction that, okay, now we try to support other initiatives within the cities that that provide you what you call safely managed sanitation. In these aspects, engage all sorts of possible avenues, engage everybody, put in ICT innovations, and try to make sure that we call on people how to empty. We are trying to involve the private sector for the first time, try to mobilize cesspool emptiers into the part of the process, compared to the original process, which were based on only public infrastructure, where we thought it was only the public that could be able to deliver sanitation services, and this has not been sustainable. So we believe that involving everybody, putting more in place some public toilets, involving everyone into the planning, creating an enabling environment where these private players, civil society, and so can thrive to put everybody into this sanitation market. It would be something that we can ensure that everybody within the entire city is included and is also served. So we shall be talking more about this in our next discussions with our colleague from the civil society, for people which has been participating largely into this citywide inclusive approaches. So the city of Kampala is almost about 4 million inhabitants. That was an approach it was turning up. In the slightly smaller towns, we piloted an approach in the northern part of the country, in smaller towns of around 50 to 100,000 people. And this one, we also something similar but slightly modified, was what we called town sanitation planning approaches. A similar approach where we try to involve everybody you can think of. And I got a very interesting picture here to show religious figures who are being involved into the promotion that you use. Someone even in church said that the preaching today is, in some church preaching, is about sanitation aspects, something considered unrated, but that everybody has to know that there are different options and different things that can be applied and can be done. We tried to create an enabling environment where people are trained on how to build appropriate sanitation facilities, sanitation toilets that can work. We engaged a national bank. This is a Centenary Development Bank, a rural development bank that has reaches in almost all households. Many people have banks into this. Tried to design sanitation packages, small-scale loans that are affordable, which can put more finances, people can explore into getting into the sanitation aspects. And other aspects, it led to a bit of more sufficient volumes where we were able to send cesspool emptiers, trucks to do emptying and safely remove this sludge from the toilets in the households and be able to bring it down to treatment facilities. But all this was done in a way of engaging the entire towns, the town councils, the religious leaders, the banks, everyone institutions, knowing that to get to appreciate that the process of getting sanitation to everybody, to all vulnerable people in society, is not entirely a public affair, but it's an affair that we all need to contribute to. In the rural areas, yes, this is again a different context. Now you come to an area these are areas that have populations of less than 5,000 or so, in more or less dense areas, more scattered approaches. There we have tried different also interventions with several partners under the Water Supply and Sanitation Collaborating Council, supported Uganda Sanitation Fund. USA supported Uganda Sanitation for Health Activity, the time as USHA, some conditional grants, trying to use community-led total sanitation approaches that ensure that the villages themselves mobilize themselves and move from house to house, ensuring that every house has an appropriate sanitation facility. This one we termed it as village-wide. So you go to any village, the entire local government, the local government council, the leaders are part of the process to ensure that by themselves see what is most appropriate. Instead of sitting down in the village and waiting for a sewerage network to ever come, which is not going to come, the near future said what can be done what is solutionable. And the villages were able to come up with, several interventions, as long as they are safe and they provide a decent facility. As you can see the pictures here, some depending on their resources, depending on their needs, and where they needed markets, some subsidy support. This is where the government tries to come in with these funding agencies, but to a small extent, by the community leading and making sure that every village, or the villages in a given district are handled and supported. Some of the brief key achievements that we are proud of, we look at, and areas which are considered, for example, informal settlements, completely off the grid, as not being having any support. We almost doubled what we call the emptying rates, because we had several approaches that supported by government, supported by all those people programs in the series program I mentioned. We doubled at least the number of people who are able to call for emptying services. Through these approaches, we had an ICT-based call center approach where they could call. In the old times before even this happened, it was almost nobody's business. They wouldn't even know where to reach, only a few. But now with an open call center known to everybody in the city, they're able to use that to get services on their premises. We developed some standards and all. In the towns, we've reached about 40 towns out of, about, still work to go. These are cluster towns. Out of about 150 towns, are done, systematic planning for each town, about 40 of them. Through these plans, the identified fecal sludge treatment plans have been built, and we've developed guidelines into a country that provide guidance to all towns and odd areas when they're able to develop, if they need to develop any sanitation interventions. We've helped them to design even town, what we call ordinances or bylaws, which are put in the given towns that this is a sanitation approach, and we, as this small town, have agreed this is how we handle sanitation, and they are taking lead into trying to ensure that everybody gets connected. In the rural areas, 40% of the villages have been reached with their promotions. Close to 1 million households have been equipped with the new toilets, and therefore with about 18.4 million people also gaining access to these emptying services and making sure all that effort towards that everybody is within this business and with this sanitation approach. Of course, despite those achievements, despite that's what has been done, there are still so many questions to be asked. There are still bottlenecks which we are trying to fight over. As I mentioned, of course, public funding. This is not only here, you've had it everywhere where it's not enough. Of course, whether it is a question of prioritizing within the limited resources of government, that sanitation interventions are not receiving enough funding. We continue different interventions. The household, I said, one of the challenges that many households that were built, sometimes when they try to empty them, we don't have sufficient emptyable toilets that have sufficient vaults. So a lot of discussions are on whether it is need for subsidies, whether these subsidies are sustainable, or is it again a question of household poverty? Is it a question of prioritization at the household? These are still challenging. And we still don't have sufficient volume of market, especially for the tariffs where we have built a fecal sludge treatment plants, as I mentioned, in small towns. We still don't have enough tariff that can generate enough revenue to sufficiently run these facilities. So they are still supported by public resources to get them moving. Then, of course, we're all discussing the same issues of climate resilience sanitation. We have cases of where sanitation infrastructure has failed because of flooding. We have cases where we have limited water because of droughts in part of the country. How to design the sanitation interventions that are affordable to the people, to communities. That for those who have been in Kampala, for instance, you find that all the low-income earners, the vulnerable communities, reside in the lower areas of the city, which are the cheap areas, which are the wetlands, and these are the areas at the same time which get flooded when it is when we have high rainfall. So how to resolve this is quite of a challenge. As I mentioned, as I presented at the start, the discussion that we have, part of the Sustainable Development Goal agenda is a focus on, look at the needs of girls and vulnerable communities. We've had a lot of discussions here with the JMP team, with the GLASS team. How do you measure this, that, the girls are actually getting access to this service, or it's the boys, the girls? So we have some statistics, but sometimes it could be something quite difficult to crystallize and make sure that we have sanitation aspects that are fully compliant, addressing the system, the need of girls. And as I mentioned, of course, the vulnerable communities are usually living in areas with difficulty in land tenure. They don't own these land facilities, so if they don't own the land, then they cannot even put a permanent infrastructure, or they are not willing to contribute a lot of development to that. But they continue to work through these challenges together. We are trying at the moment, to develop, to put all these success stories into a formal sanitation policy. We have an environmental policy that is quite old, from the 70s, and we're trying to address it, to upgrade it to this kind of approach, because of what I said earlier, where old policies are only talking of sewerage, so we need to put in that all these stakeholders, and this will be in a policy review, which are working together with the Ministry of Health. We're continuing this area. This is the policy that we are approaching, that wherever any program that is targeting a given area, then we have to look at that the entire area is looking at it. We have projects which are based on lake sanitation, the basin level approaches. For example, projects that are supporting Lake Victoria Basin, how to improve the socio-economic situation in that area. And we say, yes, then look at the entire basin and consider the sanitation aspects as well, because of the pollution that comes along. We have, Uganda is one of the countries that have the highest refugee context. So when we have any partners we're working, say, please do not be isolated, but look at the entire refugee settlement, that everybody within there, within the areas, are able to benefit. And we want to continue to look at when we have creation of new cities, that we're also going to cascade the example land in Kampala to all the new cities that come through. So with this, we think that area-wide sanitation approach presents a hope at achieving inclusive sanitation, at how to address the challenges that we mentioned, and full inclusivity remains one of the biggest challenges. And we're here to share ideas and get ideas from you. Thanks to our partners, IRC, Water for People, who are with today for this discussion.
Thank you very much, Engineer. Thank you for the presentation. Over to you, Aaron, to bring together your panel. I think, Engineer, just comfortably sit there.
Yes, thank you very much, Dr. Twino Mukunguzi. I will get it right. Twino Mukunguzi. Thank you. Make sure Clarissa knows that. No, thank you very much. I'd also like to invite up our other two panelists right now, Yvonne Lugali, and she is the Wash Sustainability Manager for Water for People, and Martha Niagaga, she is the Rural Sanitation Coordinator, Ministry of Water and Environment. And we are lucky to have three very distinguished panelists with us. I am going to step down so I can look at them and they can look at you when we're talking. But I want to start maybe with you, Felix, if that's okay, only because I noticed an omission in your future outlook slide. Your first key challenge was about financing, and there was nothing about financing in your future outlook slide. So how is it that you think we're going to address the financing gap that area-wide sanitation faces in Uganda?
Yeah, thank you, Aaron. I was hoping you'll give me a breather to fast rest, but a typical view. Yes, my pleasure. Yes, yes, I agree with you. It's I try to avoid it because I wanted to throw it to my partners to try to see what we can all think about. But yes, there's very many approaches that we are trying to look at. trying to address the financing gap from our side. One is we continue to push for public resources, for prioritization within the programs in the government of Uganda. We still believe, for example, the funding to the WASH sector in Uganda has gone down now to only about 1.5% of the national budget. So it is a very big concern from our side. We think that even with the internal resources that we can have, we can still be able to push WASH financing within the local resources to at least, we have the declaration that mandates we put about 15% into resources, but we hope that we can push the percentage of financing to WASH slightly higher from public resources. We're also trying market-based sanitation, that people, yes, especially households, try to contribute to more resources to improve resources to their sanitation approaches. We're not leaving behind the private sector. These are the typical financing sources. The private sector is being encouraged, but it can only be encouraged to bring in resources when they can see that there will be a market that can be that they can work in. So we have a lot of collaborations with the private sector to try to develop approaches that can improve financing into sanitation.
No, I appreciate that. Martha, I used to work for government, and everybody blames government all the time. We don't give enough money, it's not enough financing. But Martha, from the government's perspective, how does sanitation fit in as a financing priority? And what do you see as some of the key impediments in kind of mobilizing the resources, financial resources, necessary to make this work?
Thank you very much. Financing is still a challenge, not only for sanitation, but for the WASH sector as a whole. And in Uganda, we realized that that story is not about to change. So we are thinking innovatively to, first of all, unlock the money that exists. We are trying out several approaches. Right now, we are trying what we call results-based financing, where we are just looking at a financing landscape and understanding where the money is that is meant for sanitation and making sure we unlock that and it goes where it is supposed to go, without necessarily attracting new financing from government. Because we want to also optimize what exists and harness it to the best way possible, so that it is working for the interventions it's meant to serve. And then we are able to flag it and say we have been able to use the little that we have and yielded several results, and then we can be able to ask for more. We're also involved in a lot of advocacy work. Recently we have held a dialogue with the president because we experienced a budget cut that was almost 50% in our current budget for this financial year. So we want to understand what is happening, what are we not doing right, also from the political side. We want to appeal to the powers that be and say, look here, what should be looked at not as a social service anymore, but a driver of socioeconomic development, a driver of the economy, because indeed WASH is a driver of socioeconomic development, and we want to position it that way. Of course, we are also looking at the private sector and thinking innovatively of how much we can unlock for sanitation out there. Our biggest funders in Uganda for sanitation are the households. Much of the money that finances household sanitation comes from the households. The government takes care of the rest of the bigger infrastructure like sewerage network, fecal sludge treatment plants, but the investment for household toilets happens at the household. So we want to create more demand at the household level and appeal to the household members to be able to spend more on sanitation, and there we'll be tapping into our biggest resource that exists at that point. Thank you so much.
No, I was actually very pleased to see in Dr. Twino Mikunguzi's presentation your mention of land tenure, so to speak, and land rights. To me, unlocking local capital and household capital is very closely tied to land tenure issues. Is that part of the government's strategy, is to help provide greater access to both land rights, both for women but also for families generally, and see whether that unlocks some of those financial resources?
Yes, the land tenure system has been a bottleneck in many cases, especially in the urban areas. But engagements have gone on to interest, especially the landlords, that we want them to invest more in sanitation and look at sanitation the way we view it as government, that they're able to invest for households in a way that enables them to access sanitation all the time when it is needed. So the land tenure system is not about to change, but we are working within what is available to interest the powers that be at whichever level, whether it is at household level, individual level, or in the local council, or even in the bigger perspective of parliament and things like that, to be able to overcome those challenges that exist, to do with land rights, to be able to have women access some land, to be able to meet their sanitation needs. And that we are doing through advocacy and a lot of other messaging together with the civil society organizations.
Great. No, and Yvonne, speaking of civil society organizations, you saw the list of challenges that was up. Do you see the challenges the same way, or do you see the challenges being slightly different? What do you see as being some of the key impediments to achieving inclusive citywide sanitation? And what do you think are some of the key learnings from your perspective that could help us address this challenge?
So I think maybe I'll start with the second question, then I'll probably come to the first one. So in terms of the key learnings, looking at the efforts that we've done, particularly, and I'll draw the experience of our working with Kampala Capital City Authority in Kampala, the power and being able to leverage partnerships, I think for me is one of, that's very key. It's important for us to appreciate that there are things government can do and there are things that government cannot do. If government is the one that is regulating, then they cannot be the same people who are promoting, yeah? That already presents a conflict of its own. So it's important for us to begin to leverage the partnerships and the strength that the different players bring. As civil society, we might not be in the best position to market a sanitation product, but we can be able to get to leverage partnerships with academic institutions to develop those products, bring them to the market, and allow the private sector market them the way they would market any product, even better than us. Yeah, Martha was talking about being able to build the demand. I probably don't have that skill set, but someone has. So just being able to leverage the power of partnerships, I think for me was something that was very key and a good learning. The other thing was we need to be able to incentivize sanitation markets. If we're going to think of sanitation as a business, or we're thinking about aspects around market-based sanitation, then we need to incentivize sanitation marketing. These products won't sell themselves. The households won't just suddenly begin to prioritize sanitation. Someone has to sell it, and the households have to buy that, yeah? And so being able to incentivize the sanitation marketers, looking at aspects around social marketing and those structures to sort of put these things out there, I think was also very important. We've talked a lot about financing, but financing also has to be innovative, but we also have to look outside of ourselves. Alternative financing options, and I'll give you an example. So when we started the citywide inclusive sanitation, you're telling households, go to banks, get loans, have go and get loans for toilets. That works in an environment where people are credit worthy. What happens when they are not? Yeah, what happens when I have a loan with a loan shark, I have a loan with another bank and another bank and another bank. I can't go to another bank to also get that loan, but I need the toilet. So what do we do, and how innovative can we be in terms of other alternative options and financing? How do we look amongst ourselves in terms of our social structures, yeah? So that we can also still be able to have accessing. So we did a lot of installment methods where someone pays up front for the toilet and then someone is able to pay back. So because the program targeted landlords, it meant that they already had a source of income. So you could always say that, from the 3 houses that I'm renting out, the income that comes from this one unit will be the one that's paying back this loan for the toilet. But already the toilet has been built, and so there's some form of mechanism there. And then finally, we also have to be able to ensure that there's a bit of checks and balances when it gets to issues around standards, compliance. So you still need to market, but you also still need to penalize those who don't have, and also being able to strike that balance between the two, so that one doesn't become so punitive as to discourage, but then you're also just not taking a very gentle approach when it gets to improved sanitation. So going back to the question on the inclusiveness. First of all, the products and the services have to be right for everybody. If I walk into a supermarket and I have options, let's say on the type of bread that I would want, I should also be able to do the same for sanitation. So that it still meeting the standards, still meeting compliance, but giving me some form of range in terms of products and services. And then also ensuring that the people who are going to provide those services are also available. So a lot of input has to be put into the development of the supply side of things as well. Right products, the right people there to also provide them. Then of course, I know the issue of subsidies is controversial and there are different viewpoints to that, but I think when it gets to off-site sanitation, there's a lot of subsidization there. There's a lot of capital investment that government will put into sewer networks and the infrastructure and all of these things, but we are not seeing the same level being matched up in the side of on-site sanitation. So we also have to be able to think through, because a lot of these informal settlements, this is on-site sanitation. You don't have a sewer network in a slum area. So people have on-site sanitation. So what are we doing in terms of being able to provide the same level of support that you would give someone who's on a sewer network? And those are things we have to be able to think through as we're looking at providing inclusivity for all. Yeah, thank you.
No, thank you. I want to go back to your comment around incentives, because I think this is a very important part of the entire process. And maybe Felix, going back to you first, I mean, have you seen, what are the incentives that appear to be working? And this is a very difficult question. Again, I believe land tenure is a key part of that. If you own the land, you can recoup the costs on your investments in developing it and putting sanitation on site. If you're a landlord, there's a clear incentive. You can charge more rent and recover the costs. But for normal homeowners who might not own the land that they're on, what are the incentives? Do we have any idea of what works or doesn't work within the context of Uganda? It should be on. They'll turn it on.
Yeah, it's right on. We piloted some several incentive approaches, both in hardware and software approaches. As she has mentioned, yes, land tenure is one difficult part of it, but the incentive to that you are providing is sometimes we, as you said, the most common security that people have been using to get any soft loans has always been, land. So when we come to these areas, we say, where you don't yet have the certificate of title of ownership, we can still work on soft relationship measures that yes, they get. We have an LOC system, what we call a local council system. The leaders can certify. You get a few, like 5 people to guarantee you, and then we'll be able to. That's why we, as government, guarantee those loan facilities that we work with a specific bank. So we provide. They say we guarantee the bank that if this person is not meeting through, we shall guarantee repayment to this, but you can be able to give them as they work on the loan facility. So that incentive has worked in software that people are able to acquire loans. Yes, of course, sometimes they use the money for other aspects. They abuse it, but which is unfortunate. But at least they are able to access a loan for sanitation-related aspects. On the hardware aspect of it, we are using incentives of, for example, they are cesspool truck operators. Well, the market is fairly good in Kampala city, the city of 4 million people, so there it can operate. But in the smaller towns and the rural areas, they don't have enough market. So the approach that we are using as government, that we try to chip in public funds to acquire this truck, and then give the truck to, at a very minimal, actually only to recover the service truck. So it's a good incentive. Said, okay, if there is a truck is provided by the government, yes, I can go to the rural areas where market where at least I can meet operational costs. I think we tried this under the USAID supported project in some areas, and it quite worked because we saw that if someone has to get money to repay the cost of purchase of the truck, it was simply a business that could not work. So if he's working on it to recover the operational costs and maybe replacement and investments, this was a good incentive for a person to go out to the market. Others are marketplace where we use platforms of government, the voice of government, to help incentivize some products to the market, and it's making some success.
Oh, interesting. Good to hear. Martha, some of this has to do with, these are, it sounds simple, but these are really complex sets of issues. How much of this is really about capacity building at the local level and with local governments to be able to carry out these types of activities? And is that something the government's investing in?
Thank you. The issue of capacity oscillates between being there and being not there, depending on the time of the year that you're thinking about or whenever the question can come up. But the issue of local government capacity is something that we are looking at as government, but also understanding the kind of environment in which we operate, that local governments have staff, but again, these staff keep going away depending on the kind of opportunities that present themselves around them. We have, for example, for the staff that do sanitation and hygiene, we could say that we are about 67%, but again, these are just the numbers. When we speak capacity, we speak also about the skills that come with these people. And these also keep changing based on the needs and the emerging issues that happen in the sector. That we might count ourselves capacitated at this level, and then new things emerge and we need to build capacity again. Unfortunately, some of these expenditure lines like capacity building have over time been treated as unfunded priorities or wasteful expenditure, if I may use the word, both by government and also donor agencies. That when you have a project and you have input a capacity development component, that would be the first to be struck out, because it is not bringing to light tangible results. It's not going to increase the number of taps or the number of pipes or the number of water supply systems or sanitation facilities for that matter. So the issue of capacity, yes, needs to be rethought to see that the food soldiers, in Uganda we have a decentralized kind of service delivery model, where our capacity at the local government, where the service delivery actually happens, should be at its best, because that's where actually the service delivery happens. And we continue to engage through partnerships with civil society to continue to support the local governments to build their capacity together with government, but also to help them to progressively overcome the barriers that prevent them from doing their work well. If local governments are facing, for example, capacity challenges in terms of training, in terms of the skills they have, in terms of the equipment that they need to deliver their work, we ask and work together with the partners, the development partners in that specific locality, to support those local governments to continuously and progressively overcome such challenges through provision, for example, of motorcycles, of computers, of data management systems, and the continuous training that goes along with it, so that by the time the project leaves or the partner is leaving a specific local government, they are in a better position, but also during the time that they are there, and the local government is able to support the partner a bit better. So the issue of capacity, I think, needs to be rethought, both within the country but also from the donor perspective.
No, it's helpful. I know this was a question that was originally tailored for Felix, but I think it's more directed to Yvonne, which is around stakeholders and the engagement of stakeholders and how you bring stakeholders together around these sets of issues. I wonder what the experience has been in terms of truly getting communities actively engaged collectively to addressing some of these challenges, and what have you seen that's worked or hasn't worked? And that, I'm open to hearing both, either one of you. And as you think about that, just to turn to everybody out here, this is going to be turned into a conversation, and so I'm going to turn the microphone over to you guys to go ahead and ask questions and engage our panelists in a few minutes, so just be prepared. Please, Yvonne.
Thank you. So I think it was Martha who probably mentioned, when it gets to sanitation, I think the household is the biggest stakeholder. First of all, because they are the ones with the money, they're the ones who are going to construct the facility, they'll be the ones who will pay the emptier, they'll probably also bear some of the cost when it gets to aspects around treatment and maybe even reuse. So in our experience, I think it's very, very important for you to be able to provide platforms for feedback as quickly as you can get it and as often as you can get it. So when we develop these programs and when we sit in our offices, of course you envision the best case scenario. And you say, oh, I think this will be the product, I think we'll put it out there, this will be how we will promote it and all of those things. And so just being able to tailor that feedback loop comes back as quickly as possible, and you're able to adapt and be as agile as fast as possible to change and then be able to pick up on. I'll still go back to the experience in Kampala. When we started, of course the idea was, we need this number of households to have constructed this number of blocks within this number of years. And we had the construction companies, yes, you've trained the masons, and you're putting it out there. And the first thing was, the toilets are expensive, yeah? But then government is saying, but that is the standard in the city. So you're stuck. There's a standard the households must follow. The households are saying, we're not going to follow because it's expensive. So what do you do then? Yeah, because again, you have a donor sort of requirement that says, I need, and the report is due, and the year is ending. So what then do you do? So you quickly have to be able to bring the two people together. And in my line of work, I think I have learned that it is okay to fight, as long as by the time you're done with a fight, you have a solution, you've all come. So create the platform for people to fight. If they need to tear each other apart, it is okay. For that moment, when we are done, we leave and say, okay, this is what we've agreed. So open up the spaces for dialogue. Open up the spaces for dialogue with private sector, yeah? The city is saying you have to do your work, it has to be clean, it has to be done in this way. The private sector players are saying it's not clean work. So if it is not clean work, then what do we do? Because you still have to provide the service. So again, open up the space. So for me, I found that as more as you open up the space and as frequently as you can open up those spaces for dialogue, it's very, very critical in terms of how we can then be able to improve. And I'm glad that KCCA was able to recognize that quickly early on and open up these spaces as much as possible so that you can actually then be able to have those voices. I know there was a FICO Sludge forum. There are spaces where they engage and the coordination mechanisms as they're engaging with the private sector. At the community level, you have community activation teams. You're engaging the local council leaders as much as possible so that you can be able to have that open communication and dialogue. Yeah.
No, thank you for making that point. It's one of the things I'm always challenged by is we don't talk enough about this, I think, in the WASH sector, particularly with regards to sanitation, is the need for people who can manage process, manage dialogues and discussions, bring people together in productive ways, because often engineers aren't the best ones to do that. And it's a unique skill set that we often don't recognize. Sorry, Felix, I interrupted you.
I was just coming to that exactly. The point is that we realize in the sector connection that different players, different organizations have different skills, interests, and directions. And if we're talking about the issue of equitable supply, equitable service provision from the vulnerable to everybody in the town, then there are different approaches that need to be done. We know that Water for People, IRC, are very good in dealing with the vulnerable communities. The World Bank, African Development Bank are happy to fund the bigger infrastructure, and we tell them the softer aspects. Okay, it's not very good. It doesn't make a good, development project. So all of them, we bring them on table at different levels, and we've established different levels. She has talked clearly about the community level, but even at the district level, in areas we have what we call a district water and sanitation committee, where we bring everybody. And now recently we even bring in the politicians. The area members of parliament are members of the district committees where they belong. So every month, everywhere they have time, they go in and they sit with the engineers, with the politicians at the local government, and they put priorities, discuss them. Hopefully they don't fight as Yvonne has said, but yes, press about it in words and then move forward. At the national level, we have, we also have a bit of, no, I don't call it tensions, but we have different strength and between ministries of water, for example, and the Ministry of Health. The Ministry of Health is also strong at hygiene, promotion, and other aspects. So we also have an interministerial committee where we come together, the technical, even the ministers also join in the ministry, that we're able to get aspects from the water and environment aspects and also from the Ministry of Health put together. Then beyond ourselves of the government, we have what we call a national sanitation working group, where we bring together all partners, mainly at the national level, to put down the ideas and exactly what they are doing. Then from there, we're able to pull out some efficiencies that we can be able to try to reach every one person wherever they are.
No, thank you for saying that. And if I understand you correctly, I think you're also pretty clear that some of these market-based approaches aren't going to work for the most vulnerable populations, and that we're going to need different types of solutions in those particular settings. I wonder, Martha, I think this is also true. Uganda is, you're in a tough neighborhood these days, and there's a lot of refugees that are now coming into Uganda. And you're going to have to meet the needs of some of those populations as well. How is the government going about trying to meet some of the needs of the displaced people who are now residing in Uganda?
Thank you. Uganda's positioning as a neighbor to fragile communities, if I may use the word, puts us in a difficult position, but also provides us with an opportunity to open our doors to the people who are in need of help, that we can provide a safe space for them to live. And as they come along, they come with challenges, but together we work to progressively address their needs without necessarily endangering our own. But we have and must live together. So we have about 13 districts that host refugees in Uganda, and we have about 1.7 million refugees. In some districts, we find that the refugee population sometimes is even bigger than the district population of the locals. So we realize the challenge that can come with that, and we have put in place frameworks that guide us as we support our neighbors, but also continue to meet the needs of our own that live in those districts. We have, we developed what we call a comprehensive refugee response framework that guides refugee response within the settlement areas, but also in the host districts. So we're working together with UNHCR and all these UN agencies, together with the rest of the partners that work in the humanitarian setting, to be able to reach the refugees with WASH services from time to time. The kind of setting they live in, they stay in the transient centers for just a short time. And there the services are planned. There are permanent toilets, there are permanent dwellings and all. But somehow because of the influx, sometimes they are not able to meet the needs very well. So they are quickly taken away to what we call resettlement areas. We have refugee settlements, we don't have camps. And because of that kind of setting, they are allocated plots of land and given some tools and equipment to put up their homes and also install their own sanitation facilities. So they are given tools and other materials that they need, like some building materials to be able to construct these sanitation facilities. The water part is also taken care of, but I must say the situation oscillates between good and bad depending on the refugee settlement and how much support is coming into that specific settlement. You will find that in some places it's as low as 40% sanitation coverage. And in some places it can go to as high as 80%. In some places it's higher than the host communities. I must say in some places the situation is actually rosier in the refugee settlement. So we have to have a balance and strike a balance so that we continue to enjoy a harmonious relationship between the host communities and the refugees. That we want to implement projects that do not discriminate between the refugees and the host communities. That when we look at a district like Yumbe, that hosts refugees that are more than the host community population, we do projects that cut across. It does not matter. As long as the water can reach, it will reach. As long as the sanitation infrastructure can serve, it will serve. So that's the approach we are taking as a country, and it is working well. Thank you.
No, thank you. I hope all of you can appreciate how difficult of a question that is to ask a government person. And I thought that was a very thoughtful response. I appreciate that. I thought that was very, very good and very interesting. Can the three of you tell us, well, you know, a lot of people are talking about this climate resilient wash. Does that mean anything to you? Is it relevant to the work that you're doing? How is that realized for you guys on a daily basis, if at all?
If I can start with it, it's very relevant, and we as a government are gaining a lot of interest in it because of, yes, that we can be able to tap into the climate financing that is growing exponentially out there. But that said, as I presented in my presentings, there are some aspects of climate change that we are experiencing. Although, as I presented, it's one of the challenges. We don't have the exact solutions. That it's something that we call upon the research community to partner with us, and we continue to discuss together what exactly we can do about it. I said in Kampala, which is typical in all areas, you know, Uganda has it's not very flat like here. We have an undulating terrain where the low-lying areas are the wet areas. Right. These are the areas which the rich don't want to stay in because they are very prone to flooding. So the low income, the vulnerable, almost 60% of the people, who are the biggest number, lives in these areas. And these areas now we are beginning, I mean, with the climate change impact, you're seeing heavier rainfalls coming in. So with heavier rainfall means you have increased storm levels. So the high is very high, and they are washing down the sanitation infrastructure, both in the towns and even in the areas. So you can't get these people out. You can't contain the storm. It is a headache. We don't have the right solution, but it's together, and we hope that we find solutions towards this. It's quite a challenge.
I have this. So I think one of the shifts that has been happening in Uganda is the move away from just looking at open defecation free to actually looking at improved sanitation facilities. And one of the reasons for that is because of the issue of climate resilience. Yeah. So it's not just enough to have a structure that just is covering, you have a place to go, but it's important that that facility that you have can actually weather the storm. Engineer Felix talked about facilities that are washed away, and I know those ones are very common in Kampala. So again, I'll draw back to our experience, because I think a lot of that has, sort of, when people mention climate resilient wash, you don't really understand it until a household that you supported to construct a toilet facility calls you and says, well, I'm not going to pay back the loan because the facility that was constructed doesn't exist anymore, because there was a road and that road's drainage wasn't properly planned. And so when the rains came and the wind blew, it came tumbling down. Yeah? So now there it gets real, because now it's something that's even affecting other bits and pieces. We've been talking about financing, but if the facilities that you're telling people to get loans for are not being protected against all of these things, then it definitely becomes a problem. So climate resilience is actually very important in terms of even just the structures and the designs and the products that we are promoting. You have to be able to think about that. Otherwise, what we are essentially telling people is, we're almost as if saying, oh, you can have it today and then maybe tomorrow you don't have it. And they're investing a lot of their hard-earned income into these facilities. So it definitely becomes real at that point. Yeah, thank you.
Yeah, no, but please.
Thank you. They have given all the examples in the community, so I will speak to the macro level, that as a government, as a sector, we take climate resilience very seriously. And we have a whole department in charge of climate change, and we're really mainstreaming and fast-tracking our climate change interventions. We have conducted our climate vulnerability assessment for the water and environment sector and for WASH specifically. And we have understood what it is that we are vulnerable to as a sector in terms of WASH service provision. And we now know how to move forward. We're in the process of developing our national adaptation plan for the WASH sector. And we are moving well in terms of climate change awareness out there in the communities, in the districts, and of course working together with the stakeholders. We know we cannot go it alone, and we know that we cannot do without having that conversation of climate change. That when we invest so much money, and we know that the floods happen in certain places, they will certainly wash away the infrastructure. So we are going into planning and investing in climate smart technologies, and also building the resilience of the communities in a comprehensive way, so that the WASH resilience is also taken along, because it doesn't really help us to just improve the resilience of the WASH infrastructure, but the community is left vulnerable in that regard. So we have plans and doing interventions that help to improve the resilience, the holistic resilience of the communities, so that the WASH infrastructure moves along that chain.
You know, I very much appreciate your answers. You asked about the science and research, and to be frank, we don't have good science right now on the impacts of climate change, let's say, on these types of systems. Certainly we know how extreme weather events are beginning to affect these systems, and that's important to know. And you mentioned stormwater management, which I think is probably the most critical issue to a lot of our infrastructure and how we manage stormwater. And Yvonne, I very much appreciate your mentioning the fact that, because some of the things that we found in our research is it isn't an extreme weather event that caused the failure. It was the fact that the system was not designed properly, built properly, properly maintained, sited properly, as you mentioned, Felix, and so all the engineering fundamentals weren't done right to begin with. And so investing in the professionalization of these services and ensuring these systems are built to those standards, I think built and maintained to those standards, is an important part of achieving that resilience. And Martha, you mentioned social resilience, which I completely agree with, right? Which is empowering the communities and giving them the resources to be able to adapt and respond as these conditions begin to happen. Because we're going to see things we never thought of before. And it's that resilience that's really going to come into play. Please, we have a question from the back.
Right, thank you. I think I have a question for Engineer Felix. I think I do appreciate your presentation in terms of being very candid around the challenges surrounding area-wide inclusive sanitation. We've seen the same around city-wide inclusive sanitation as well. And you did mention something around gender, which I appreciate. And we've been having a discussion around intersectionality, that it's not just about women versus men, but also the different lived experiences of people. Particularly for rural communities, you did mention that you are serving more than 1 million people through this initiative. And I just wanted you to briefly talk to us about how that is addressing gender inequalities, cultural conflict in rural areas, especially as it concerns to getting access to sanitation. Thank you.
Yeah, please. Question is yours.
Yeah. Thank you very much, Mitch. I'll add my own also goes to Philip. So I look at the future outlook that you presented. I must say that Martha has done a good job. I remember 2019 when we were in Uganda on the citywide inclusive sanitation training with the World Bank. And I think she's the one who has really moved forward with it. Ghana, we have not done so much with the area-wide citywide inclusive sanitation. But my question to Philip is, when you look at the future outlook and reviewing your environmental sanitation policy, do you have any plans of financial investment? When you look at your baseline, how much are you planning for on-site? How much for maybe condominium systems, treatment plans, so that you have costed policy that when partners come, they will be able to fit into which aspect of the value chain that you need that support from, looking at the considerable contribution from the household as well. Thank you.
Great question.
Yep. Thank you very much. I think we can start and make concern on that. And yes, starting with the last question, it's yes, we are starting with this policy inclusiveness, and when we put together, then we, of course, as I presented, we are doing bits and bits within situation, trying to attract different financing. But the limitations, part of the limitations has been that lack of a formal or comprehensive policy put on paper. So when the different development partners come to begin, they say, okay, please bring us your policies and your guidance. If we invest, for example, a fecal sludge treatment plant that is not really sewage based, how are you going to manage this? Now, if you go into our policies, as I said, if you go into the official documented policies, you'll only find National Water and such of Sewerage Corporation, so anything which is not sewage. So National Water says, is a fecal sludge treatment sewerage or not sewerage? So by policy, they can take it up, they can refuse to take it up. So this one to refine and then get into the next stage. And it's in thought that we come up, then we start developing investment plans for different areas. We started this into a process, but we are looking out discussing with the development partners who will help us to come up with investment plans for these areas. We've tried it and we came up with something in Kampala, which shows the kind of investment that we're requiring. It was coming something, especially at off-site sanitation, we need an investment of about 150 to 200 million US dollars over the next 10 years to try to reach inclusive sanitation with these other on-site sanitation improvements. So we will try to do that over a country, but at the moment we don't have one comprehensive issue. Martha will talk more about the inequalities, vulnerabilities, but yes, as I presented, it's a challenge that we acknowledged. I always have challenges when we are reporting to, our partners are very interested in, whenever you see we've invested in facilities in schools and wherever it is, they want this gender information, how much is serving the girls' needs and serving which genders, which vulnerable communities. I said we do, for example, infrastructure-wise, we try to
include facilities for dispose of sanitary pads. We try to include facilities for temporarily disabled. But to the extent of use of these facilities for those girls, to the extent of use is a bit still problematic in monitoring and ensuring that this is being done. It's a bit of a challenge, but we acknowledge we're trying our best. I don't know, Martha, if you have something to add to that.
Yes, I will say that solving the sanitation challenge, even at the household level, is addressing a woman's needs. Just by doing that, you are solving women's problems. If you visited a typical household in a home, rather in a village, you will find a woman and her children, and if the toilet is not available in that home, it is that woman that's going to be suffering. It is that woman that will have to answer questions, difficult questions from her child. Where do I defecate? From the visitor, where do I go? From everybody else, from the health workers, where is your latrine, where is your toilet? So by the mere fact that you implement sanitation improvement undertakings that improve sanitation at household level, you're really addressing gender issues, you're solving women's problems, because they're the ones that are in the home. They're the ones that spend most of their time there, and inadvertently they are the ones that are affected by the absence of the sanitation facility. Thank you.
Question over here on the right.
Paris, for the presentation. You made mention of Uganda having about 45 sewage and fecal treatment plants, and that is quite impressive for doing that. But I wanted to know if the objective is to treat the sewage and fecal matter, or also you go beyond that and do bioresource recovery from the sewage sludge, and in case you do, what type of resources do you recover, and what technologies are in place, and what is the purpose or the application of these bioresources? And in Uganda, do you have regulations for the application of these resources as well? Thank you.
Yeah, thank you very much.
Thank you.
The immediate option, of course, as I mentioned, this approach of full sanitation service chain for resource recovery is something that we have tried to push in a bit new. So old plants that were running, old plants did not have resource recovery initiatives put in them. So it is actually collaborations with people, with Water for People, that we come to Bugolobi, the main treatment plant of the city, to try to improve how we can make briquettes that can be used as fuel, how to use to make this fertilizer a bit safe. So it's the initial intention has been really more about having a place, having a facility where safe treatment, safe disposal can be done. So prior to this integrations, there were quite few, and you'd have, we have a classic example where we talk about in about 5-10 years ago, we discovered this, now Uganda is beginning to do oil exploration in the midwestern part of the country. And when we do oil exploration, so we have international companies which are coming in, Total and other UK companies. And now when we have international business, so we have to do now the environmental standards, environmental application is very strictly applied. So camps are put in Uganda about, it's about 300 kilometers from the city, and they were established for this oil exploration, and they built up, mobile toilets. And after, 1 year, these toilets were full, and said, okay, what do we do now with this? So they tried to empty this fecal sludge matter. So where do we dispose it? In an environmental certified way. We had to move that sludge for over 200 kilometers, which is very ridiculous. So 200 kilometers, because there was nowhere in the 200-kilometer radius where you could safely, officially dispose this facility. So that's why we came and said, no, this is embarrassing. We need to get these plants in several parts of the country so that you don't have to travel 200 kilometers with shit in your vehicle to dispose of. So this was the first immediate push that you have areas that it can be put. But as we're doing that, we are progressively now doing areas for soil recovery. The the sludge, the sanitized sludge use in agriculture field is very attractive. Uganda is a very agricultural area, so people will like it. I've used it myself. It's very fantastic when you apply on your field. Of course, there are problems of sanitation, but we are also currently good enough. I mean, we don't have a lot of industry connected, so it's so far it's been the testing has been generally okay, and we are actually in the process of developing standards and guidelines of how this should be applied. At the moment, have not been enforced, but we are developing this with Makerere University Research.
That's great to hear. One more question.
So much. Thank you so much. I'm Grace Beeler from the Appropriate Sanitation Institute. And my question is, you were talking a little bit about opening up space for disagreement. I'm wondering how the community outreach works within inclusive sanitation. Are you training engineers to work with communities? Do you have a social work team? Do you focus on listening to what communities want, what individuals want when you're creating solutions, and how does that work? Thank you.
Thank you. So maybe I'll start off right from the point of the design. So we are doing a lot of human-centered design. So right from the beginning, you have that. So the engineers are having that dialogue with the household owner, just to say, you know, this is the type of facility that I want, this is how I would want it to look like. So even just being able to build their capacity as well, to not only be an engineer, but to know that the engineering component that you will do will be small, but a lot of the interface that you're going to have with the community is going to require you to develop your social skills. One of the other things that we are also doing is, so at the national level, you do have sort of those coordination mechanisms that even sort of cascade down in terms of a district. But for many of the towns, there was a bit of that gap. Yeah, so a lot of efforts around Engineer Felix talked about the town sanitation plans, but then with that comes stakeholder forums that still provide opportunity to have that dialogue. You also have sanitation task forces that are bringing together the technical teams and the political teams to sort of still have those dialogues. One of the things that we are also encouraging is having reflection sessions or sanitation management review meetings where you say, this is the plan that we made, where are we, how much have we done, how far have we done, why did we not achieve that, and just have that honest conversation, and then even score ourselves and say, so this is where we were and this is where we are now, what do we need to do to sort of be able to move that balance. But also one thing that we've also found is the importance of evidence, so that you're not just appealing. Yes, you can appeal to people's emotions, but it's also important for you to tell people what the real issues are and what do the figures look like and what's the implication of if we don't solve this issue, if we don't do this, what does that then look like? So just being open with that information, being open with the data. I know the ministry does, the Office of the Prime Minister does that assessment. I think that sort of annual assessment. Now, when I realized it now became a real key factor where districts are saying we also have to be seen to improve. If we didn't do well last year, we have to be seen to do well this year. So what is that issue that's failing us, and sort of garnering everybody around, politicians, the technocrats? Because when you win together. So if there's an issue, then you somehow have to be able to come together. So just being able to open up all those avenues and the dialogues, empowering the village health teams, empowering the community activation teams to get those dialogue skills and sort of negotiate and promote and, market, just to get everybody talking about this is some of the things that are being done. Yeah, thank you.
Okay, this has been a great conversation. I want to give you each a couple of moments to reflect on what advice would you give to any of us who want to engage in these types of programs around community-led sanitation in some of these types of areas. What one or two things have you learned that you want to pass on to us and the rest of the community? And I'll start with, because you gave us a list forward-looking. So I'm going to start with you because you're probably the quickest and best prepared for that. And then I'll go, just so you know, I'll go to Martha and then to Yvonne. Felix.
Rhetorical, just stay with the same words that, again, there's need of, they call it mind shift from us, from the engineers. I'm a civil engineer by training, and most of these designs come to us when we are supposed to make designs. We need, as a country, need to change the mindset of developers, everybody, that when we give now, that's why we push for this as a topic here, that we need to begin to think about holistic approaches. The training that the background we had, the professors were going to teach, we are taught wastewater treatment. And that's why when you go to the world, you go to implement wastewater treatment. When you go to wastewater treatment, I'm only talking about, it's only sewage. And then I reached Kampala, I said, okay, where is the wastewater? You don't have the wastewater that's not able to come in, so you have no waste to treat. So I have to go and look for this waste and how to get it to the site. So need to change a mindset in training our young engineers going to the field, especially the developing world, that yes, we must have to think of a collective way, how the social aspects of it, the engineering it, how do we get this waste there, then once you treat it, how do you dispose it of it? So the needs of a mindset around how this waste, because the collection and bit of it is really much more complicated actually than the treatment in itself. And getting everybody in a different setting is quite challenging, and we hope we shall get the right solutions going forward. We don't have yet. Thank you.
Thank you, Felix. Martha.
My parting shot takes me to scale. I'm an advocate of scale, operating at scale, because when I think about the burden that we have regarding universal access, we cannot achieve it until all of us are thinking scale in whichever way possible. If you are operating in a village, go to all of it in the best way possible. If you are in a district, it wouldn't help for you to jump from one to another before this is covered, because all those efforts that you have done will disappear in the big bad, yeah? And then there is no time to keep going back and forth. So when I think about the kind of stage we want to go to of universality, I can't help but think of scale, so that in the end there is no one left behind and we can together shine. That calls for a lot of things to do with coordination and high investments and optimization and rationalization and all that. But in all, we want everybody to have access to a sanitation facility, and we're not going to do it if we keep scattering our efforts here and there. So scale is my parting shot. Thank you.
Yvonne.
I feel like Martha has taken my answer. But, so I've been reflecting upon, regardless of the village that you go to, even in the deepest, you'll always find an alcohol beverage. And so I've been reflecting on how do they do it? And what can we learn from how they've developed their market, how they've worked on their distribution, how they engage. And there's even, and they don't even think about things about my willingness to pay, ability to pay. They just, it doesn't matter what village you go to, you will always find an alcohol beverage. And they've worked out sort of all the kinks along that market. So what can we learn from them that we can bring? Because sanitation is a need, alcohol is not. So what can we learn from what they have done, and what can we also do? So we need to develop our markets. We need to develop the right products, the appropriate products, products that can be used by everybody. We need to open up for the private sector and give them even the space. A lot of times we open up, but then we confine them. So how can we open up and then give them the space to sort of run with this if we are going to achieve universal sanitation? And those are my parting shots. Thank you.
So the advice is the first thing to do when you show up in town is to get a drink. Thank you very much. What a great panel. I appreciate it. Thank you to Jane for kicking us off. For our distinguished panelists, Felix, Yvonne, Martha, what great and wonderful answers, and what a great learning experience it has been for the last hour and a half. We really appreciate your time today. So thank you, everyone. Thank you.